A 26-year-old daily wager presents with an ulcerative lesion over the right anterior cheek, which proved to be SCC. The lesion is 2 into 3 centimeter with depth of 13 mm. There are multiple neck lymph nodes measuring between 2 to 5. Let us see what is the TNM. So, if we want to understand the concept of TNM in this, we will understand what it is. Okay. So, what is the TNM? How the TNM is? Let us see this. Now, when we talk about the staging TNM for oral cancer, this is very important for your exams. Students, we have T1, which is less than equal to 2 centimeter or depth of invasion less than equal to 5 mm. T2, more than 2 up to 4 centimeter or depth of invasion more than 5 mm up to 10 mm. T3 is more than 4 centimeter or depth of invasion more than 10 mm. And T4, it is any size with local infiltration. So any size with local infiltration, this is very important. So any size with local infiltration. Now try to understand, this is very important. Local infiltration into the skin, into the mandible, that is 4A, T4A. Then into the muscles of mastication, into the muscles of mastication, that is a T4B. So they are very important things. We have T1, we have T2, we have T3, we have T4. Now when we talk about N, how do we see the N part? How we see the N? N1 is defined as solitary lymph node less than equal to 3 centimeter. N2 is further divided into 2A, where you have solitary lymph node more than 3 but up to 6 centimeter. 2B is multiple lymph nodes but none of them more than 6 centimeter. 2C is bilateral lymph nodes but none of them more than 6 centimeter. And N3 stands for any lymph node more than 6 centimeter. So more than 6 centimeter any lymph node. Then there is a concept of extranodal extension also. More than 3 centimeter, less than 3 centimeter. So extranodal extension less than 3 centimeter is N2 and more than 3 centimeter is N3. Let us see this question. Size of the lesion is 2 into 3. According to size, it qualifies for T2. But depth of invasion is 13 mm. So according to this is qualifying for T3. So first T is T3. Multiple lymph nodes of 2 to 5. So T3, N2, B, MX. So the answer for this is D. D is the right answer.